Hi, I'm Rick Barron, and welcome to another episode of REF5. This is in the History of Neurology series, and today I want to talk about Charcot et les Peeps, and his trainees. So the great Jean-Martin Charcot is really the founder of modern neurology. He established clinical neurology as a discipline. He became the first chair of the disease of the nervous system in Western universities. He had a very humble beginning. He was the son of a cabinet maker. He actually had difficulty passing his oral exams to become professor in the French system, but he ultimately did. And shortly after that, he was named superintendent of the Salpêtrière in Paris. He was 37 at the time. The Salpêtrière was a large welfare medical institution that housed 5,000 to 10,000 poor patients with medical problems, and it was chaotic, and he organized the system. He organized how to diagnose the patients, and he did clinical pathologic correlations, and he was focusing particularly on diseases of the nervous system, although he did have other interests as well. He became an expert brain neuropathologist as well as an expert clinician. His fame expanded when he started doing Tuesday and sometimes Friday lessons that were well attended by physicians, and we'll talk about that in a little bit. Later in his career, he became interested in hysteria, and some believe he used hypnosis in his practice, but that's sort of controversial. Interestingly, he was against animal research. So here is a picture of the great Charcot. It seems like almost every picture I'm going to show you, it's him in profile. This is one of his many books, Diseases of the Nervous System, and this is really the Tuesday lectures that he gave, and they were he made extensive notes, and also notes were made by people in the classroom. And then he had his trainees, his mentees, put these into book form. And many of his trainees were British, and George Sigerson was one of them, and he is actually responsible for getting the English editions of the lessons in print, and that's how I was able to access Charcot and many in England and the United States. So here's a picture of Charcot looking at one of the brains from a patient who had expired, his classic hunched posture, and this has become a famous image. Here's another old neurologist with a hunched posture looking at his cart. Charcot really described the neurologic complications of syphilis to a great degree. In tabes dorsalis, he talked about the joint problems that patients with tabes get as a result of the sensory deprivation, and now we call those Charcot joints. And here is a picture of a woman who has difficulty walking with Charcot joints of the knees. Here is Charcot with his wife at their home, and sort of the classic picture of him in profile. He was a great artist on his own right, and he was able to draw patients with neurologic problems. And here are some of his notes with showing a patient with a hemiparesis and some extension deformities. There's also a picture here from one of the magazines in France. This is how Charcot was depicted in the magazine, and these drawings in the back are, of course, his drawings. And these look like they're drawings actually of hysterical patients in various contortions. Here is the Charcot library at the Salpêtrière, and this is a picture of the Salpêtrière in Charcot's time. Now, what I wanted to talk about was all of it, that he trained legions of neurologists and psychiatrists. Here's just a few of the folks that he trained, and I'll mention them briefly as I go through this slide deck. Of course, there's Pierre Marie, who was his right-hand person for a number of years, and he went on to describe cerebellar ataxia, spinal cord diseases, and of course Charcot-Marie tooth disease. He was Charcot's disciple, and they wrote the paper in 1886. Tooth in England also wrote a similar paper, and so we know it as Charcot-Marie Tooth. His famous book is Lectures on Diseases of the Spinal Cord. Then there's the famous Babinski, and we know him for the extensor sign, or the Babinski sign. There's Desjardins, who really had many contributions in facioscapulohumeral muscular dystrophy and the classic Desjardins pain syndrome. I'll talk more about some of the other things he described in just a minute. And then Russi, who was also worked with Desjardins and Charcot, and was involved in describing the Desjardins-Russi pain syndrome and some forms of hereditary neuropathy. Here's some more of Charcot's famous trainees: Tourette, Georges Gilles de la Tourette, who described, of course, tics, and we call it Tourette syndrome now. Henry Perinaud, we talk about the Perinaud dorsal midbrain syndrome with vertical gaze paralysis, often due to pineal tumors. Broussard actually first described the locus niger as a possible site for the lesion of Parkinson's disease, and he actually became chair at the Salpêtrière after Charcot, after Raymond was the chair. Pierre Janet, who became extremely famous and one of the founders of psychology, trained with Charcot, as did Bournville, who described tuberous sclerosis, we now know as Bournville's disease. And he actually was one of the disciples that edited the Leçons in French. So these are all French disciples, mostly from Paris, but also from some from outside of Paris that came to train under Charcot. Charcot also trained a number of individuals from foreign countries. Here's one more slide of Pierre Marie, who, while he worked under Charcot, was the chief of the laboratory, and then at age 60, he went away and was at other universities for a few decades, but then he came back and succeeded Desjardins in Charcot's chair. Here is the face page of his famous diseases of the spinal cord. Here are a number of eponyms that Desjardins is responsible for. Of course, there's the Desjardins-Russi pain syndrome. There's also the Desjardins syndrome, the medial medullary syndrome. There's the onion peel sensory loss in the face that he described. And then the Desjardins-Klumpke paralysis, a brachial palsy that Desjardins and his wife, Augusta Marie Klumpke, described. And she was actually an American physician who's one of the early American neurologists, if you will, that had a major contribution. So as I mentioned, Charcot also trained a number of visiting scholars, and some of these have become extremely famous in Western civilization, and I suppose the most famous is Sigmund Freud, who trained briefly with Charcot, who was only there for a few months in Paris, but it had a profound effect on Charcot's development, ultimately in creating the field of psychoanalysis. Marinescu from Romania trained with him, and he subsequently became the chair of neurology in Bucharest. He published many papers, and he described the inclusions in the substantia nigra Marinescu bodies. And then the famous Russian physician Vladimir Bekhterew trained with a number of European neurologists, including Charcot, and he led the famous clinical neurology and experimental psychology department in St. Petersburg and then Leningrad after the revolution. So here is the well-known painting called A Clinical Lesson at the Salpêtrière. This is actually a colorization and a modernization of the painting, so you can actually see who these individuals were, with Charcot demonstrating with a hysterical patient some of the phenomena. Here's Babinski, here's Gilles de la Tourette, Broussard, Marie, and a number of other French neurologists and other people in the French community. Here's Charcot's son, who was a physician, but then actually became an explorer, and that's how he spent the bulk of his life. And that's how neurologists used to be trained in a classroom, but now we're in the modern era, and we're training neurologists often by the internet and with videos like this on REF5 on YouTube. So here is our modernization of the Charcot Lessons picture with this guy here demonstrating, and some of the very well-known neuromuscular neurologists throughout the country who are involved in the REF5 and the RRNMF. So I hope you've enjoyed this segment of REF5 on Charcot et les Peeps. Thank you very much.